So Dr. Spector, first what I want to start in talking to you about is a little bit about your background. You are a doctor, obviously. You're an oncologist, is that correct?
I am. I am an oncologist. I've been an oncologist for 25 years. I do cancer research as well.
And your whole life you've wanted to be a doctor?
My whole life, it was either that or a politician. So I decided that I didn't really want to go to law school, so I decided to go to medical school. No, I've always been exposed. My family, my father was in research. My mother was a psychologist. So I've always grown up around research and medicine. Yeah, it's been a long passion of mine.
And why did you want to be a doctor?
I think I wanted to really make a difference in people's lives. I wanted to, you know, when I went to college, I realized that medicine, this may sound like a cliche, but it really is the most noble profession, despite all that's happening in medicine. You know, you really get to know people at a level that you can't get to know in any other profession. I mean, when somebody's got, especially in oncology, when someone's got a life-threatening illness, it really strips away the veneer. So whether they're the richest person in the world or somebody found under a bridge, you know, they're still dealing with the same life and death issues. And so you get to know somebody in a way that you could never get to know them, you know, by being a lawyer.
And I would think that when it ties into Lyme disease, especially, which is why we're talking about this, what you just said really drives that home. I mean, to have a doctor that cares about you, to have a doctor that sort of understands you intuitively,
Right.
to have a doctor who wants you to be on the same page as them, has to make all the difference in the world.
It's all the difference in the world. I mean, the doctor-patient relationship is all important. You know, despite, you know, and I have a laboratory and I'm involved in precision medicine, which uses all the, you know, the human genome and all the information to do cutting edge, and I've been involved in cutting edge research. Despite all of those advances, which are amazing, it still comes down to a physician and a person. Because if that person doesn't buy into their care and doesn't feel like they have an active role and doesn't feel like as a physician I'm listening to them, number one, they're not going to be compliant with any of the treatments, or they're less likely to be compliant, and they're going to have a lousy outcome. So you can't rely on, I think we've become so virtual medicine oriented and test oriented that we've forgotten that basic element of human to human contact is all important. I mean, having a doctor hug you is therapeutic.
Yeah.
So, you know, but we've forgotten that. And so, yeah, no, I think that especially for Lyme disease, a disease where, you know, where people often feel very isolated from the healthcare community, who may not believe that they're sick, often sadly isolated from their own families, who believe it's all in their head and they're, you know, they're faking it, or they, you know, they don't want to go back to work, when people are really suffering. So I think having a physician who understands, and I understand from a personal level, so it gives me
Deeply
sort of that,
personal.
yeah, that sort of street credibility,
Yeah.
that I understand what people are going through.
So how did the physician become the patient?
So I went from being, you know, this incredible model of health. I mean, I ran Boston marathons. I used to run 10 miles a day, 6 days a week. I did everything right. I mean, I didn't smoke. I, you know, had my glass of red wine every once in a while. And
Which
then
is good for you.
Which is good for you. It's good to have a glass of red wine every once in a while.
Right.
So, you know, and I wore the white coat. I figured I was immune to getting sick, right? I mean, I took care of people, not the other way around. So I got bit by, you know, a tick and never saw the tick, just like a lot of people with Lyme disease don't remember. The ticks are almost like a speck of dust. And then for 4 years, I had, so I went from running marathons and running an avid exerciser to literally within a span of months to barely being able to walk 20 yards without having to stop for extreme fatigue. So I knew something was wrong, and I was having arrhythmias, so my heart would start racing upwards of, you know, 100, 200, 180 beats a minute, when the normal heart rate is probably 70, for no reason at all. And as a physician, I knew this is not normal, there's something wrong. And yet every time I'd go to the doctor, they would run a slew of tests, never Lyme disease tests, and say, we can't find anything wrong with you. You know, the arrhythmias are very transient. I would make the analogy, it's like when you bring your car into the mechanic, and you say to the mechanic, oh, there's this noise, it's binging over here, and then the mechanic drives it, and of course the noise is gone.
Right.
And they just look at you like there's nothing wrong with your car.
Yeah.
So the same thing, I would go, and every time I'd go to the emergency room, the arrhythmia would have resolved, and they would say, you know, you're a physician, you're
So you
writing
told
grants.
them you were a physician. They knew that you.
They knew I was a
Were
physician.
you going to your hospital where you were practicing or affiliated with?
I was going to the medical school that I was working at, and I had very compassionate physicians. I mean, don't get me wrong, but because they were so focused on the tests, and my blood counts were normal, and my chemistries were normal, and again, by the time I would be seen, my EKG, the tracing of my heart rhythm would be normal, and they'd say, "You're stressed, right? You're trying to write a grant. You're writing grants for your lab. I was seeing very sick patients, bone marrow transplant patients at the time. My wife and I were trying to start a family, which was very, frustrating and challenging, sadly. So there were stresses, but I kept telling people, I've been stressed in my life. I mean, as an intern and a medicine resident, I worked 120 hours a week before the days where they were restricted.
Right. What's more stressful than going through medical school in your residency?
Exactly. And I had never experienced the sorts of symptoms I was experiencing back from 1993, through 97. So for 4 years, I went misdiagnosed as having a stress disorder. People told me to do biofeedback, do meditation. I did all those things. They were great. I mean, but it didn't change. I mean, I was still incredibly fatigued. I had, I had such strange symptoms that I don't think my doctors knew what to think about it. I mean, I had this burning sensation in my feet that was so bad that I had to prop my feet off the bed because otherwise it was like a searing, burning sensation. I'd have these night terrors. I mean, when I mean night terrors, they weren't just nightmares. They were just horrendous.
Full-on sweats.
Yeah, they were things that woke me up. They were, strange. I mean, strange for me. I had severe insomnia. Again, I knew myself, and this is like the message I had always told my patients. You know yourself better than any physician, whether they graduated from Harvard or Columbia or wherever. I mean, only you know yourself. So I knew myself, and I knew that these were very atypical for me, and there was something really wrong, but no one could figure it out.
So how did you get from a place where you knew that something was wrong to a diagnosis, a correct diagnosis? I'm sure there were many misdiagnoses.
Right. So what happened was after 4 years and literally, I knew I was dying. I mean, I really knew that I was going to die.
You didn't just feel you were dying?
No, I knew I was dying. I knew if I was a physician taking care of me, someone like me, I would have been preparing the family that this person, look at them. I'd lost weight. By the way, I was still working every day. So during this whole time, I was running my lab. I was seeing incredibly sick patients. But I knew that it wasn't going to last much longer unless somebody figured out. So in 1997, after 4 years of being told I was stressed, I developed what I think, that's really when the light bulb went on. So I developed arthritis. I mean, really severe, like I could barely hold things in my hands, my wrists, my arms, and swollen joints. It wasn't just pain, there were swollen joints. And I was given an antibiotic for a completely independent reason, not for the arthritis. The antibiotic turned out to be doxycycline, which is the antibiotic that's given for people with Lyme disease. And my arthritis within 24 hours completely resolved. I mean, went away 100%. And it was around the same time that I developed, again, a telltale sign of Lyme disease, what they call third-degree heart block, which is not an actual blockage in the blood vessels, but it's the electrical wiring system in the heart that maintains our normal heart rate that we all take for granted. I mean, we don't walk around taking our pulse. We just assume it's there. So mine was blocked, meaning that the impulse that creates the normal heart rate, the impulse wasn't getting through. There was a blockage in the wiring system. And so I had a heart rate of about 40, and I knew that wasn't normal. That might be fine for a marathon runner, but I hadn't run in 5 years.
Right.
And so I went to the doctor, and I'll never forget, I was laying on the table, they were doing the EKG tracing, and as it's coming off, now they have very smart machines that actually give you the diagnosis. You don't even need a cardiologist. And so I'm looking over at the tracing, and it says complete heart block, third-degree heart block. And it's funny, my first reaction was, that can't be me. That must be the person whose tracing was stored on mine, because as sick as I was, I just, that can't be me. So, but it was me, and that was third-degree heart block or any heart block as a sign of Lyme disease. And I put it together, I just said, and I always had suspected, I'd lived in Massachusetts. I had run, through the woods, and so I put it together. I said, look, I've lived in an endemic area. I've had extreme fatigue. I now have third-degree heart block, and I've had these arrhythmias for the preceding 4 years. And those arrhythmias, by the way, were finally captured on a monitor that I wore for 72 hours. And it turns out that they were a potentially fatal arrhythmia called ventricular tachycardia, which is one of the most common causes of sudden death among young people.
Wow.
So I had had thousands of episodes over the preceding years, any one of which could have easily killed me. I mean, easily. I mean, it was amazing that I was still alive.
Yeah, it's a miracle.
It was a miracle I was still alive. In fact, my heart tracings went up in the cardiology fellow's office as a learning tool, which is something you never want to be. There were so many I was having pauses between heartbeats of 6 seconds, which is like an eternity for your brain not to get oxygen. So it was amazing that I was alive. And so I put all of that together, and I told my doctors, I have Lyme disease. And even with that, they sort of said, well, I don't know. So I was at the University of Miami at the time. And, in Florida, Lyme disease was like 150 out of 100 on their list of diagnoses.
Yeah.
And so we sent the labs off. And a few days later, I got a call from my cardiologist saying your test is negative. Now, when most people, when a doctor calls and says your test is negative for Lyme disease, you figure, okay, the test is negative. This doctor's educated, the test is negative.
Right, we'll move on to the next.
We'll move on to the next thing. Okay, maybe it wasn't Lyme disease. Maybe I have all the signs and symptoms, but for some bizarre reason I have something else. And at that time, I didn't really understand the controversies over Lyme disease testing. My test was really not negative. It wasn't completely positive based on the letter of the law that we can discuss as to why that's a problem and why many people are falling through the cracks because of this dogmatic rules that have been established for reasons as a scientist that are beyond me. But anyway, so they put a permanent pacemaker, and then I had an episode of prolonged ventricular tachycardia, so they had to put a defibrillator in. So I essentially had a 911 unit in my chest that would shock me if I had a potentially fatal arrhythmia, which we can talk about. I had several shocks along the way.
So how did you get to a place where you needed a new heart?
So I lived 12 years. So I finally was diagnosed. I had the test repeated. I forced my doctors to repeat the test. They diagnosed Lyme disease. Finally, I was treated aggressively with antibiotics. Most of my symptoms resolved, but the damage to my heart was permanent. And then I lived from 97 through 2009 with a severely damaged heart. 10% heart function.
Wow.
But living a very active life. And then in June, actually, of 2009, there were several episodes, and I just went downhill very quickly. I went into florid heart failure. Over a span of literally 10 days, I looked like I was 6 months pregnant with all the fluid accumulating in my body. And it became very clear that I wasn't going to live, and was told by a surgeon that I had 72 hours to live on a Friday afternoon, July 17th, that I would be dead by Monday without a heart transplant.
Wow. Do you feel as if the medical community failed you? Do you feel as if your own medical community failed you?
So let me just say that, again, my physicians, I think, were very frustrated by not knowing what was going on. I think the medical community in the Lyme disease world has failed patients. So yes, I don't blame, people ask me, do you blame your doctors? I don't really blame my doctors. I blame the people that have created a dogmatic approach that influences doctors as to, how they treat patients. The problem is we've lost the art of medicine. So I had all the signs and symptoms. We have a saying in medicine, if it's like the Aflac commercial, if it quacks and it waddles, it's a duck, not a zebra. Mm-hmm. I was quacking and waddling, saying, Lyme disease, and yet because of the way Lyme disease is diagnosed in this country and around the world, I was diagnosed as a zebra and not a duck initially. So yes, I blame the establishment that has created an environment that unfortunately has let hundreds of thousands and over the years millions of people down and fallen through the cracks.
And this might be a little bit unfair, but was there ever a point in your life where there was also a lot of guilt that you as a physician, somebody who is highly trained, who knows the jargon, who knows intuitively what's going on with your own body as you tell your patients, but also on a more macro level what's happening,
right,
that you also did not know almost immediately or very soon after you started experiencing these symptoms that something was wrong and that it was Lyme?
Yeah, I think it's very difficult when you're really sick to, you could say, well, you're a physician, you're a scientist, why didn't you think about this? But when you're really sick, often it's hard to, to see that clearly, and literally see that clearly. I mean, I had, brain fog at times, so it wasn't even figuratively, it was literally. So and I'll be honest with you, after a while with enough people telling you, there's nothing wrong with you, there's nothing wrong with you, it's stress, there is a part of you that starts to wonder, well, maybe there isn't really anything wrong with me. I mean, thankfully, that was fleeting. But you start to think, these tests, and again, no one really looked at Lyme disease early on.
Yeah.
But you start to question, well, maybe, maybe it is, maybe I'm working too much, and maybe there's other things going on.
What I can't understand is that with 300,000 people diagnosed every year, and if it's my understanding that there are more cases of Lyme disease diagnosed every year than MS and I believe breast cancer, if I have that correct.
Mm-hmm.
With something so prevalent, I don't understand from a layman's perspective how the medical community has not sort of come together to say, if time after time after time, this is the disease, this is the diagnosis that people have, why don't we start there? Wouldn't it be a lot better to start at Lyme and then, flesh that out and then move on to something else instead of working through every other option and eventually ending up at Lyme?
Yes, no, it would be. So I think there are areas in the country that are more aware now. I think one of the problems, to be honest with you, is if you live, and it's bad enough in the Northeast and in the metropolitan area, in the places where we know that Lyme disease and the co-infections, so remember, it's not just Lyme disease, it's the other 5 things you get from a tick bite, where we know they're more endemic. So there is, I think, more awareness, although it's not where it needs to be. The problem, and I think my situation exemplifies that, is when you're outside that area and develop symptoms. So again, I was in Florida, and I don't even think it crossed anyone's minds about Lyme disease. Or if you're in North Carolina, where some physicians say, well, Lyme disease doesn't exist here. So if you're in a part of the country that is not considered endemic, you're out of luck because it's not even on a radar screen for a physician. So yes, it should be. Look, if you're in the metropolitan area and you go to the Hamptons and you come back and all of a sudden you're
Right.
incredibly fatigued and having headaches and arrhythmias, I mean, Lyme disease should be right there. Or if you're in the Cape Cod, it should be. Again, one of the problems is that physicians often have been indoctrinated by, I'll just put it in quotes, the existing science around Lyme disease, which gives them a false sense of security in often misdiagnosing this.
In your opinion, why has there not been an outcry? Why has there not been more on a national level, or perhaps on a funding level?
Right.
Or I said this to a couple people that I interviewed earlier. It's crazy to me that in the United States Senate and in our Congress, that I can find one elected representative that has championed this cause. And yet you have so many others that have championed other worthwhile and deadly illnesses, diseases, epidemics, but yet this one that's taking so many members of our community, no one is stepping forth to say, where's the funding, where's the research, where are the tests, on and on and on and on and on.
Right. So
why don't you think that's happening?
I think one reason is there's this perception that's been communicated to the highest levels in Washington and to the funding agencies that this is a disease that's easy to diagnose and easy to treat. And so if you're making decisions about priorities, so if that's the perception given to you by some of the top academic infectious disease people, you know, you name the institutions,
Right.
and they're telling people at the NIH, this is no big deal, then, you know, if you're dealing with Alzheimer's and pancreatic cancer and diseases where we know there's really lack of good effective therapies, then funding, you know, breast cancer where there's strong advocates and, you know,
Yeah.
do breast cancer research, there needs to be more money. And,
Right.
but those are diseases that we recognize are problematic and need to be addressed with funding. There's no sense of urgency because the message coming up is this isn't a problem. And unfortunately, the voices of, you know, advocates and real-world people and physicians who are out in the community treating folks is being dismissed as, you know, crazy lunatics, people who are just complaining. You know, that's sort of this fringe of people who are suffering. You know, everyone else is doing fine except for, you know, these people.
Yeah.
So that's the perception, and that's why, as long as that's the message that's being heard at the level of the people making decisions about funding, there won't be adequate funding for this.
But you say there's a lack of urgency, but it nearly killed you.
Yeah, no, I'm not saying that.
No, but I'm just
Yeah.
saying, like, in you're one.
Right.
You're one person who has chronicled your journey in a book.
Right.
It nearly killed you. I
Right.
wonder how many other people it has nearly killed, or how many people it has physically killed, and how many families it's ruined, and how many lives it's destroyed, just based on the fact that it has been misdiagnosed, when there
Right.
is a treatment available.
Right. So we know that people have died. Even officially, we know that people have died. I mean, the Centers for Disease Control put out a report of 3 young people who died of sudden death, probably from cardiac arrhythmias, who had undiagnosed Lyme disease. And one of the individuals, I think, had been to a doctor before she passed away complaining of palpitations. And, you know, if you see somebody who's, you know, 29, 30, whatever she was,
Yeah.
and they come in, they look healthy, and they say, I'm having some palpitations, probably the immediate reaction is, well, you're stressed, you're anxious, whatever. And then she ended up dying. And they found the Lyme disease, the bacteria causing Lyme disease, when they were inspecting the hearts to donate for transplant.
Wow.
So we know even the government, you know, has documentation that people have died. Now that is really the tip of the iceberg.
Yeah.
If you ask anyone who has connections with people in the Lyme disease world, we know that people are dying all the time. We know that people are committing suicide. There's a very high rate of suicide among people suffering from chronic Lyme disease.
Yeah.
So this is a devastating illness, but it's not perceived that way. I mean, so one of my missions that I feel through the book and through speaking is that as somebody who, you know, has been in research, who has been involved at the highest levels of research, that telling my story will hopefully be more compelling, that, you know, I'm not somebody who's out there, you know, on the lunatic fringe, that
You're not a quack.
I'm not a quack. You know, I've been in academics all my life. I've developed 2 cancer drugs. I've published in the best journals. And so if this is happening to me, you know, I feel obligated. I need to be out there saying, we need more research, we need more awareness. The state of care for people right now is woefully, you know, in big need. It's bad. I mean, I'll be honest, it's bad. The testing is lousy. The treatments, you know, in cancer, we are light years ahead of where we are in Lyme disease. That's largely thanks to funding for cancer research.
Well, it seems that we're that way with MS, we're that way with other autoimmune issues
Right.
and diseases, and yet not with this one.
Right.
My last question for you is, can you tell me from a physician's perspective and also from a patient's perspective, what questions need to be asked or phrased in what way so that people start to get answers? So if we can sort of move the conversation forward, if you're watching this at home
Right.
and you're thinking, as a patient, what question do I need to ask? What would you tell them?
So I'd say one, if you specifically for Lyme disease, or if you suspect you have Lyme disease. So one, I would ask your doctor what that test result means. So if your doctor says, well, your test is negative, don't accept that at face value. Because again, negative doesn't mean negative in the terms that lay people think. So I would say, what does that mean? You know, I want to see the test. And what what do I have then? I mean, so what is going on with me? You know, don't accept just a blanket statement. I mean, physicians are human like everybody else. They, you know, they make mistakes. They often don't even really fully understand the tests they're ordering. So, you know, you need to be a very active participant in your healthcare. And I think when it comes to your gut instincts, you know, look, I've lived in an area where Lyme disease is prevalent. I have the signs and symptoms. I can overlay them with the classic Lyme disease symptoms. I'm not going to stop until I find this answer. Be tenacious. Mm-hmm. And if you don't like what you're hearing, go to another doctor. You know, don't worry about insulting your doctor. Go to another doctor. Get the answers. It's your life, and your life is potentially at risk.
And as a physician, I know that this is not your particular area of study, but as a physician, if someone comes to you and says, Doc, I think maybe, possibly, I don't know too much about this, but it seems like maybe I could have Lyme disease. For those physicians who immediately discredit, or for those physicians where Lyme disease isn't their first thought, what advice, professional advice, do you give them?
So my advice is use the clinical skills and judgment. The reason why you're a doctor is not just to interpret tests from some lab. You're supposed to understand that person. You're supposed to be able to think out of the box. And so be open-minded, don't be dogmatic, question, question, question. You know, if we all just made diagnoses based on some recommendation, perhaps from an agency that doesn't even see patients, then, you know, then healthcare would be in a pretty bad state. So as a physician, if you suspect and if your patient comes to you and is telling you, I think I have Lyme disease, doesn't mean like everyone who comes in has Lyme disease. I mean, I'm not somebody who sees Lyme disease everywhere in the world. Mm-hmm. But I think you have to have it on your potential diagnoses. And you have to understand where the controversies are. And the controversies are in the testing, quite frankly. You have to understand that not everyone comes in with the nice bullseye rash like on the store. You know, everyone's looking for the target rash. It doesn't happen that way all the time. In fact, it happens more that you don't see a rash, or you see a rash that doesn't even look like that. Or what if you have a rash in your scalp? Who's going to see that? Yeah. Most people don't even remember getting bitten by a tick. So you have to put these myths out of your mind that, you know, that this is what I'm told, this is what Lyme disease, all the little bullet points, nice rash, got bit by a tick, flu-like illness at the wrong time of the year. Those things, it doesn't happen that way in the real world. So I tell physicians, you know, think out of the box, use your skills, use your judgment, and use the test to hopefully confirm what you think is going on. But don't use them as the ultimate, you know, holy grail. You know, there was a time not too long ago where, first of all, people didn't even recognize that AIDS was AIDS. Mm-hmm. And they probably could not have foreseen a time where people would be able to live with that disease and live, for the most part, full lives with maintenance drugs. There was a time where cancer, especially with breast cancer and other types of cancer, where it was a death sentence immediately. Do you foresee a time, can you look into your crystal ball, do you foresee a time where Lyme disease will be something that is so widely understood by the medical community that we don't have to have conversations about the lives that it's claiming and the controversy that it's generating and the it being miscategorized and misunderstood by so many people around the country and around the world? Well, I think the time is changing now, to be honest with you. I think there is, you know, a tide that is coming in that's going to be hard to reverse. So I think what's going to lead to that, so let me just say this. There are cancers that we can cure now, or certainly treat, and people are in long-term, you know, remissions, that 25 years ago when I was first training, I never would have thought imaginable. I mean, there's a percentage of people now with metastatic lung cancer. You know, it used to be a death sentence, 6-9 months. Yeah. You know, now there are people years out who, you know, I'd like to think they're potentially cured. Metastatic melanoma, get your affairs in order, you know, 5-10 years ago. Now there are people being cured. If we could cure those diseases, we can cure Lyme disease. I mean, I refuse to believe that we have to allow people to suffer. So what we need and what is happening are we're going to bring people who are not necessarily, Lyme disease researchers, but bring people in from immunology, bring people in from cancer research, where the lessons of how we've been able to transform the treatment of cancer are very relevant to the discussions about how we should be treating Lyme disease. We're going to bring those people in. We're going to get them involved. We're going to use the lessons. We don't have to reinvent the wheel. And I think that's going to change. That's going to change. There are better diagnostics. People who were never involved in Lyme disease research are now seeing there's a huge need and are developing diagnostics that are better than the current diagnostics. So things are going to change. We may have to drag some people kicking and screaming, and we may just have to leave a generation of physicians out of the loop. But things will change. I mean, I feel fairly confident that I can almost promise you that.
I hope you're right. For your sake and everybody else's.
I feel very confident that things will be changing.
So you were given this new heart off of a transplant list.
Right.
Do you know anything about your donor?
So I know a little bit about her. So I have a female heart, and I always tell people if I get emotional at times, it's just that female heart, giving me that added.
Your sensitive side.
My more sensitive side.
Yeah.
So I know that, so I'll tell you one story, it's in the book. After the transplant, my daughter decided we needed to name the heart. I mean, we couldn't just say your new heart. So she decided to name the heart Heavenly Precious. And so I wrote that in the letter to the family. And the letter was heavily censored. You couldn't say who you are. Mm-hmm. And sadly, there's been some incidences where people have said, I didn't want that person getting, my loved one's heart. Yeah. So there has to be this exchange before you can openly contact the family. So I wrote that in the letter that this, in addition to other things, this was so meaningful and such an amazing gift of life that we named the heart Heavenly Precious. And so when I finally got the letter from the family, the husband wrote to me that had incredible meaning for him because he actually called his wife Precious. He never called her by her name, he called her Precious. And in fact, he sent me a picture of a perfume called Precious that he had put in a frame by his bedside. And so he felt that that was his wife's way of communicating to him that everything was okay.
Wow.
Yeah.
I mean, that's not something that can be explained.
That's not something that can be explained.
That's not a coincidence.
No. Well, I don't think. Look, I'm a scientist. I believe in rigorous, prove it to me. But I also believe that we don't know a lot of things, in this universe, and that's one of them. That, and I'll tell you another story just about the heart because people ask me about this. What's changed in my life.
And how you're doing today.
And how I'm doing today. So what's changed is that when I finally was discharged from the hospital after the transplant, I was home and I was surfing through the channels. And I don't know whether I was attracted to HG, Home and Garden TV, which I didn't even know the channel existed. And I became fixated on the channel, especially some of the, the House Hunters International. And I'm an avid basketball fan. I gave up basketball tickets to watch House Hunter International shows and HGTV. So I don't know whether that was,
that's Vicky,
or the fact that I love dark chocolate now, which I never loved before, that's Vicky. But I'm doing great today. I am back to running. I'm not running full marathons, but I ran 3 half marathons last year. Wow. I run pretty avidly, so I feel fantastic.
Are you 100%?
Well, I'm older than I was when I was last 100%. So,
right.
And I still take medications to prevent, organ rejection. But thankfully, I feel great. I mean, I am, I literally have 2 jobs. I mean, I have my cancer job and I have my passion for seeing improvements in Lyme disease. So, if there were 40 hours in a day, I'd be happy. So, yeah, I live a very, very active life.
Wonderful. Thank you.
Thank you.